Our last group of multicellular parasites are the cestodes, which are sometimes also called tapeworms. They are flat and ribbon-like. They have segments. So the trematodes are also flat, but they don't have segments like the tapeworms do. Cestodes have a structure that's called a scolex. It's analogous to like the head that they can use for attachment. And then they have all of these segments here called proglottids. And then this is some imaging of proglottids of different species. And they use that for replication. The first cestode we'll talk about is Taenia solium. This is also called pork tapeworm. Infection in people is associated with the consumption of undercooked pork. The majority of people don't even know that they're infected unless they find proglottids in the feces. So we'll start here with the life cycle. Proglottids are passed in the feces. The proglottids will mature into an embryonated egg, or the proglottid itself can be ingested, let's say by a pig. If there is ingestion of the proglottid or the embryonated egg, the larvae will hatch, penetrate the intestinal wall, and burrow into muscle. And then if the larvae have burrowed into muscle and they are consumed, the larvae will exist in the small intestine and develop into adults that will reproduce. So that's kind of the life cycle. Generally, people will acquire a pork tapeworm infection through the consumption of larvae found in pork muscle. Some patients may experience some discomfort, indigestion, and diarrhea, but not all. So oftentimes a patient will only know that they've got tapeworm because they see the proglottids in their feces. And again, if you've ever had like a cat or a dog that had a tapeworm, it looks like the little rice grains in the feces. Oops, excuse me. There we go. Diagnosis is based on the presence of the eggs or proglottids in the feces. This is what the egg looks like. Remember the proglottids. I'll go back here. The proglottids look like this. Okay. They look the little segments. Okay. So you could either have the eggs or the segments in the feces. Treatment should lead to passing of the adult worm. And these worms can be pretty long, feet long. So it's not going to be a surprise. Like you'll see it and that's the worm. The eggs are identical to beef tapeworm, so it can be really difficult to differentiate which species is causing the infection. However, the proglottids are specific. So again, if you see these structures, beef and pork tapeworm have different looking structures because these are called uterine branches. Pork and beef tapeworm have different numbers of uterine branches. There is treatment available. It's relatively straightforward. And of course, infection can be prevented by the proper cooking of pork. That's the classic way that most patients will present with a pork tapeworm infection. However, there is a more dangerous form of a pork tapeworm infection, and that is called Cysticercosis. Generally, people get a pork tapeworm from the consumption of a larvae that has encysted in the muscle of a pig. Rarely, a patient may accidentally ingest an egg or a proglottid. This could be because of auto-infection. For example, if you already have the tapeworm in your intestines and you're passing proglottids, if you don't have good personal hygiene, you could get proglottids on your hands and get those in your mouth. So that's why we always wash our hands after we go to the restroom. Or if a patient has an infection and they don't practice good personal hygiene and somehow you get exposed to something that they've contaminated with proglottids. So yucky, but that's what happens. Now, what's dangerous is if a patient consumes the embryonated egg or a proglottid, the larvae will then burrow and try to form cysts just like they do in the pig. And what's really, really dangerous is if they go to places like the brain. So the eggs hatch in the stomach, the larvae will migrate throughout the body and encyst, because that's what the larvae do. And then the larvae wait to be consumed so that they can mature into an adult. So this is a section of a human brain where this is neurocysticercosis. So our body will eventually calcify these lesions, and this can be fatal if it happens in the brain. So again, if you eat the larval stage in the muscle, you'll develop a classic tapeworm infection. If you eat something that's been contaminated with proglottids or eggs, you will develop the cysticercosis. So this can be diagnosed by the presence of the lesions. Treatment is difficult because, again, a lot of treatments don't always work against larvae, but a couple of these drugs do work okay against some of these tapeworm larvae. And as they die, that causes a lot of inflammation. So steroids could be prescribed to help reduce some of that inflammation. And if necessary, surgical removal of cerebral or ocular cysts. Our next tapeworm is Taenia saginata, which is the beef tapeworm. This is the most common tapeworm infection in the US, and it's acquired through the consumption of undercooked beef. Very, very similar to the pork tapeworm. The cow will ingest a proglottid or an embryonated egg. The larvae will encyst in the cow's muscle. A human will consume undercooked pork, which contains the larval form. The larvae will then exist in the small intestine and form eggs. And again, the patient would most likely notice this because of the passing of eggs or proglottid in the feces. We have previously talked about the idea that bacterial infection like E. coli is also commonly associated with contaminated beef. The thing about, let's say E. coli, right? If you have a steak, you're gonna eat steak, and let's say you like raw, rare, whatever, steak. Let's say rare. You like rare steak. You're not gonna eat it raw. We'll come to raw in just a minute. But let's say you eat rare steak. Generally, you at least want it seared on the outside, right? You get it, that nice sear, that nice char on the outside. That will almost certainly kill any E. coli on the surface. And E. coli don't burrow in through the muscle. So it's basically if during the butchering process, some feces got on the muscle, there could be E. coli, but the searing process should remove that. Perfect. But if your steak is rare all the way through, it would not get rid of any tapeworm, right? It would not destroy the Taenia saginata larva. When you talk about something like ground beef, the reason E. coli is really commonly associated with hamburgers is because picture that hunk of muscle that's been contaminated with feces. With ground beef, that hunk of muscle is ground up, and bacteria that were on the outside could now be on the inside. And if you want to have your juicy burger with pink in the middle because you don't want it all hockey pucked out, it's entirely possible that you could get E. coli from that because you haven't cooked it all the way through. So E. coli we usually see with like ground beef, but tapeworm you're going to see with undercooked, like rare beef. Now, some people like beef tartare, which is raw. That's your jam. That's fine. No judgment here. You just have to be really careful and be aware that this is a possibility. The symptoms of a beef tapeworm infection are very similar to those of a pork tapeworm infection, very similar diagnosis, but as I mentioned before, the proglottids have a different number of uterine branches. Treatment is identical. Prevention, identical. Proper preparation of beef. If you want to have no risk of tapeworm, you've got to cook your meat all the way through. Okay, our last tapeworm, our last cestode, is a fish tapeworm. I'm not going to try to pronounce the genus name. I'm going to abbreviate it with the letter D, so D. latum. It's a fish tapeworm, one of the largest tapeworms in the intestines. It can reach between 20 and 30 feet. It has 2 intermediate hosts, crustaceans and fish. Again, I'm not going to ask you about the life cycle. That it is what it is. Patients, human patients, will get the infection through the consumption of raw or undercooked fish. So the patient will eat the larval form that's inside of the fish, will mature into an adult. The adult will start laying eggs, right? There's your life cycle. In patients who are infected, they could be releasing anywhere from, up to 1 million eggs per day, or passing some of the proglottids in the feces. The proglottids look a lot different from beef and pork tapeworm. So beef and pork tapeworm, remember, their proglottids are longer and more narrow. Fish tapeworm proglottids are very long, or very wide, I guess, and kind of short. The infection occurs worldwide. People everywhere around the world get fish tapeworm. However, it's primarily seen in cooler climates, especially where raw or pickled fish are consumed. Fish-eating wild animals will serve as the reservoir. So I didn't include a video in this set of slides, but I should have, because it's a funny video. But there's a video out of, I think, Alaska, and there's a bear just, running around, and it's got like feet of tapeworm hanging out of its tush. So you could always Google that, find it on YouTube or something. Maybe next semester I'll remember to include it. The majority of patients, just like with all of the other tapeworms, are going to be asymptomatic, but because this tapeworm consumes the nutrients that you are ingesting, in approximately 40% of patients, there are lower levels of vitamin B12. And some patients, very low numbers, fewer than 2% of patients, will actually develop a B12 deficiency. So the infection can be diagnosed by the presence of eggs or proglottids in the stool. Concentration of the stool is not necessary because, 1 million eggs per day, there's plenty of eggs in there. It can be treated with niclosamide, which is one of the really common tapeworm treatments, B12 supplementation until the patient is able to recover from that. Prevention involves properly cooking fish, treating sewage before it goes into lakes, and treating anybody who's got an infection. So a lot of times, people who eat sushi, when they hear about the fish tapeworm, they're like, what? I can't eat raw fish. You can, that's totally your call. But a lot of, at least in the US, sushi grade fish has been flash frozen so that hopefully any tapeworm that would be present, so any larvae that would be present in the fish, will be killed. Hopefully, right? Hopefully. So this video I did include is a video of a colonoscopy, and you can see the fish tapeworm inside the patient's colon. It's very short. So you can see it moving around. You can kind of see the proglottids, how big they are. And let's watch it one more time. So there you go. So you see the tapeworm moving inside of this patient's colon. Okay. So this was a story from Fresno a few years ago. I was like, oh yes, perfect. I get all excited when it's local tapeworm. Fresno man pulls out a 5-foot tapeworm while on the toilet. So he was experiencing some discomfort. He felt something when he was using the restroom. He reached down and started pulling and thought it was his intestines. Why you would keep pulling if you thought it was your intestines, I don't know. It turned out that it was approximately 5 feet of fish tapeworm. So you can see the length here, kind of all rolled out. These are usually a foot long or so. And he brought it in like this, just wrapped up on a toilet paper holder. You can see all the proglottids and everything. This patient, he ate raw salmon like every day. That was his thing. He loved raw salmon. So even people in Fresno can get fish tapeworm.